Hey everybody, this is Dr. Hassaballa coming to you live from the hospital with another episode of the Healthcare Musings podcast. Today I wanted to reflect on a conversation I had with one of my colleagues who runs an ICU in the Midwest. And we were talking about the emotional toll that working in an ICU can take on an individual physician or clinician. That emotional toll can be quite significant on that person, especially if they put all their heart and soul in the job, because they will frequently come in early, stay late. They don't want to dump a lot of work on their partners who are coming in to cover them in the night shift or the day shift. And they just, it's not uncommon for clinicians such as these to stay several hours after their shift, finishing up work or trying to ease the burden on their partners so they don't feel that they're dumping on them. And I think on one level, this is commendable, right? It's great to see a clinician have so much passion for care. I would want my doctor to care that much. At the same time, we talk about the advantage of having a shift-based job is that when your shift is over, you leave. You don't have to bring your work home. Unlike other care models where you may leave the office, but you have 3 hours of charts to finish at home, or patient messages to answer, or authorization requests, or whatever the administrative burden it may be on a clinician. We keep touting the advantage of shift work is when you're done, you're done. And while passion for the field is something I want for every patient, I have that same passion for the field. That's why we're still here. And I have to say that the clinicians, the doctors, the nurses, the APPs, the respiratory therapists, the physical therapists, the occupational therapists, the pharmacists, everybody who are at the bedside today really care. They really care about being in the field. They really are answering the call because a lot of other people through the pandemic jumped ship and are doing something else now. So the ones that are left really do care. They really want to be here. All that said, it's so important to look at the long game. I mean, you have to preserve your longevity in this field. And so, I make it a point for all the practices that I oversee. When your shift is done, go home. When you're, especially, now if you have a one-person coverage model where the night person leaves and takes call, I understand it may be difficult to leave a burning fire, or a patient very sick, leave them in the hospital and go home. That I understand. And in a program where there's 24/7 coverage, where there's someone relieving you either at 7 p.m. or 7 a.m., when your shift is done, go home. Get the F out. That's what I want to be more explicit. Go home. Your partner is fresh. Either your partner has been resting during the day, getting ready for the night shift, or your partner has been resting at home and is ready for the day shift. It's commendable you don't want to dump so much work on them. It's great that you really care about this particular patient. At the same time, we need you for the long haul. We need you to be fresh. We need you to be there not just 2 weeks from now, but 2 years from now, 20 years from now. And part of that is care for yourself. Part of ensuring that you will be there for the long term is that when you're finished and you go home and you get out. When I come on shift, I am like, I got it. Don't worry about it. I'm here all night. I'll take care of it. And When I'm coming on, I try to help the day group as much as possible. But if something comes in and my shift is over, I'm so sorry. I couldn't get to this. Can you take care of it? And my partners are like, oh, absolutely. They're always like, absolutely, I'll take care of it. I mean, that's why we're partners. That's what we mean by partnering. We're helping each other. It's super important that when I'm coming on at night, I'm working a night shift now, when I'm coming on at night, that I make sure my day partner goes as fast as possible home. And the same thing, when my day partner comes in, I want to go home. I want to rest. I want to decompress. It's not like we don't carry what happens in the hospital with us. I mean, we remember the cases that were bad. We think about what we could have done differently. We go over in our head, well, should I have done this or that? And it is so important that that you go home and you relax and you decompress and you cut off work so that you can recover mentally, physically, spiritually, emotionally for the next day, for the next shift. And so, especially in programs that have 24/7 coverage, where there's a doctor or an APP or both every hour of the day, it's my group practice, it's my group norm, it's my personal norm. When your shift is done, get the F out. Go home. Go away. We love that you want to stay, and I want you to stay in this practice for 2 decades. I want you to finish your career with us. And if you burn out because you're emotionally exhausted by having to by your own choice, stay longer, then you're no help to any patient if you burn yourself out. So that's my advice. In any place where you have a partner coming in, go home when your shift is done. They'll take care of it. You're not dumping. You're taking care of yourself. And if you don't take care of yourself, then you can't take care of your patients. Go home. Thanks so much for your attention. Thank you for listening. And until next time, this is Dr. Hassaballa for the Healthcare Musings podcast.